Hello, it's your favorite nurse, Nurse Amy, back on your screen. And today I'm going to be answering some questions that were sent to me, via my email and DM'd via my Instagram. And so I'm just going to take one of the first question or clarification. Okay. Again, when I do this thing, it's okay. You can get back to me and we continuously learn from each other. Some things are set in stone and other things are not. Depends on where you work, depends on the state you practice in, and depends sometimes even on the county. Okay. So one thing I want to talk about, CNA versus PCA. Okay. So you have the certified nursing assistants. Now they are both certified nursing assistants, usually. Okay. However, one thing I have found, and maybe it's in the state that I practice in, but I have worked in at least 3 different states. I've worked in the DMV area, which a lot of this, what I'm talking about, is from there. I've worked in Ohio. I have also done some stints in Indiana and Kentucky. I think that's about it. Look, I've been doing nursing for so long that I have all these experiences stacked up. Anyway, quickly, when I talked about the CNAs and the PCAs are basically the same, one thing you have to know though, in most states in the United States, if you are going to be taking care of geriatric patients, meaning the older patients, you would need to be certified and skilled in their care. So, for you to work in the hospital, you do not need to be certified. You don't need to be certified nursing assistant. You can actually go in, they train you, and that's that. Okay, so I know, again, if you need clarification, you can write to me, you can leave your comments, but it's good that at least we're getting the truth out. Okay, so I have had people say, well, CNAs are not just into basic nursing, they also are able to do invasive tasks. Okay, I want to clarify that. That is a half truth, or should I say that is not the whole truth. So I'm going to use this analogy. So I'm a registered nurse. I'm not a nurse practitioner. So the fact that I'm going to get my NP doesn't make me a nurse practitioner. I have to get my certification, my license, and so I'm able to practice in that scope, in that realm of practice, as designed and spelled out by the board that presides over my job description. Does that make sense? So what am I saying? A nurse practitioner is a registered nurse with advanced training. So you could also, again, I'm taking liberties here, say a PCA. It's possible that a PCA is a CNA or a nursing assistant with advanced training. Does that make sense? One thing you need to understand, a lot of PCAs, and I do get people who work in a hospital who are still passing through the CNA program, and they have told me, now they haven't been through any nursing program, any certified nursing program, but in the hospital, they claim, okay, I haven't seen it, but they say they have been allowed to check blood sugar, insert Foley. What other invasive things are they doing? Catheterize patients, like be able to put catheter in them and drain urine and those kind of things. Those are very invasive procedures that are skilled. They are term skilled. However, as a patient care tech or patient care assistant, it's possible. If you have been trained, your facility covers you. And again, you have to understand, in the hospital, you have doctors, you have nurses, you have nurse practitioners, you have all this body of professionals around you that can oversee you. So you're not necessarily by yourself practicing or carrying out those procedures, right? Now, let's flip that around to a regular certified nursing assistant, okay, who works in a nursing home or works home health care, or works, let's see, even some type hospital settings that are not as advanced, because again, different hospitals has the different tiers. Okay, so having said that, a certified nursing assistant does basic care, assist activities of daily living. That's what you do. That is what you do. You're assisting them to ambulate, you're walking, transferring, changing, essentially helping them to be able to do basic everyday stuff. Me saying this is not being putting down CNAs or maybe talking down or undermining their importance. Please check all my videos. Check all that this video, this YouTube channel is about, and you will find, in fact, I can say you will be hard pressed to find a nurse who stands up and who promotes and protects CNAs. I do. But the fact still remains, you must practice within your scope of practice. It's not enough for people who say they give injections, they're able to give, categorize people, be able to get urine from them, checking blood sugar, even putting oxygen and water. Those are skilled duties. If anyone is delegating you to do it, it must mean first you have been trained, you are trusted, and you can give a positive return demonstration, and they are supervising you and taking responsibility for you. You are not a regular CNA, so please do not confuse these messages or these facts. You have to practice within your scope of practice. You have to practice within your policies, the policies and procedures of where you work. If you work in a hospital, you've been covered. Okay? So one size doesn't fit all. Do not say, well, CNAs are not, they just don't wipe ass. First of all, I don't even say that. And I don't think a lot of nurses say that. CNAs actually, I find, are the ones who talk about butt wipes. You put yourself down. I don't think a lot of people do that to you. Having said that, you need to understand me. There will be those who will bully. Nurses get bullied, okay? I think someone had passed a comment like, how would you feel if doctors, say demeaning things about nurses, the way nurses say about CNAs? What world have you been living in? A lot of times doctors are very rude to nurses. Doctors and nurses butt heads all the time, okay? If you work in the hospital, you will see that happening. Again, there is that bullying culture in healthcare. It is what it is. You just have to find a way to navigate those landmines, okay? So having said that, I just wanted to, again, to differentiate and to clearly spotlight the differences between CNA and a CNA with advanced training that, again, you could see them as they're called patient care techs and patient care assistants. I have friends, I have colleagues who work in the hospital, and they're surgical techs. Okay, so again, you cannot refer to those as just, oh, they're nursing aides. They are skilled. They have been taught skills, and they're overseen by doctors and their nurse managers and supervisors. Now, if we can still go on with this if we still need clarification, and a lot of you write to me, those that really want to know what is and what is not. Just the way I tell my students, when you are anywhere, just because a supervisor is asking you to do something and you've watched them do it, but you've not really been taught, and you think, oh, you're going to take it on, you are taking a risk. You're playing with your certification or your licensing. Don't do anything you're not comfortable with. Don't do anything you don't understand. Okay, you're not impressing anyone. If you get caught, you're going to be the only one going down. No one's going down with you. Any nurse that delegates a duty or a procedure to a CNA and you do it because you don't want to get fired, you don't want to be bullied, you don't want to be mocked, it's a risk you're taking. Now, do those things happen? Yes, they do. But again, if it's your livelihood, you want to be very careful and work within the scope of your job description. So I hope I was able to differentiate between, the different types of CNAs, okay? CNAs, the average CNA does basic nursing care. All right, thank you, and I'll see you in the next video.